Hello everyone, this is Dr. Adnan and I'm going to talk about USMLE High Yield Antibiotics chapter. This is not going to cover step 1 only, it's about step 2 CK and step 3. So here I wrote like simply site of infection, what are the common bugs and what are the empiric treatment. So I made a slide, wonderful slide, and it's all about covering most of the infection which they ask in the USMLE questions. So starting from community acquired pneumonia. So community acquired pneumonia. What are the bugs? So we'll talk about strep pneumo. If they ask you direct question, what is the most common is strep pneumo, H influenza. Mycoplasma is an atypical picture, atypical pneumonia, and we have Legionella. Okay, so covering its antibiotic, we're going to talk about outpatient. What do we cover with? So the outpatient we always cover with what? Azithromycin. Now inpatient or hospitalized, that's a wonderful question, that when they ask about hemodynamically unstable patient, curve 65 or anything like that. So what do we need to remember in hospital? We think about always ceftriaxone plus macrolide, azithromycin you could say. So azithromycin combination, you have a choice: moxifloxacin, fluoroquinolones, or levofloxacin. So this is what I coverage. This combination are fluoroquinolones. Now we go for the next. Next is we're gonna cover on hospitalized, hospital acquired pneumonia, or healthcare associated pneumonia, which or you can say ventilator associated pneumonia. What are the most common bugs? Think about it: hospitalized, so Staph aureus, which is MRSA, and Pseudomonas. So we're gonna cover these two bacteria by giving empiric antibiotic will be Staph aureus. MRSA coverage will be vancomycin plus anti-pseudo anything piperacillin tazobactam, and VAP same thing, vancomycin plus any two anti-pseudo. So what I have written down here is peptazo, cefepime, ceftazidime, carbopinime, ciprofloxacin, and gentamicin. So anti-pseudomonal, two pseudomonas. Okay. So now the next is aspiration pneumonia. What will be the bug? Simple, we know that's anaerobic. Anaerobes. So how we cover anaerobes with clindamycin. So this. Okay, so next is we have let's go top to down. So we have appendicitis and diverticulitis. Appendicitis and diverticulitis. So what are the bugs? Gram-negative and anaerobes. Negative and anaerobes, right? So how do we cover with ciprofloxacin or ceftriaxone? Cipro or ceftriaxone plus metronidazole, which is flagyl. Now the next thing I wrote it here is spontaneous bacterial peritonitis, which is very high yield concept. So I'm gonna write SBP, spontaneous bacterial peritonitis. What are the common bugs? So the common bugs are gram-negative. And how do we cover with? So there are like two treatments. Prophylaxis we give with ciprofloxacin and treat with ceftriaxone. So the prophylaxis will be ciprofloxacin and the treatment will be ceftriaxone. Okay, so far so good. We're gonna go to the next, going from top to down. Let's talk about cystitis. Cystitis and pyelonephritis together. Nephritis. These are the conditions, and what are the bugs? As we know, E. coli. It will be in both, like both. So E. coli. We have Saprophyticus, Strep.